So you rest for 2 weeks, your hip feels better, you go for a run, and by mile 3, the pain is back. If this cycle sounds familiar to you, you're not alone. And today, physical therapist and run coach Sarah from Legacy Rehab and Performance is going to show you why rest alone will never fix runner hip pain and the 3 things women runners must do differently. Welcome back to the Healthy Runner Podcast. I'm Dr. Duane Scotti. If this is your first time here, we help runners over 40 get stronger, run faster, and enjoy lifelong injury free running. Today's episode is a special one because I got an incredible guest with me, guys. Sarah is the founder of Legacy Rehab and Performance and creator of the Empower HIP program. She is a fellowship trained doctor of physical therapy, avid runner, weightlifter, and hiker who conquered her own hip injury with conservative care only, and now specializes in helping women runners rebuild strength, consistency, and confidence after hip injuries. She's also the host of the Legacy Running Podcast. Welcome to the show, Sarah.
Thank you so much for having me. I'm really excited to nerd out about the hip with you today.
Oh yeah, we can always talk hip. So I'm excited about this as well, and really kind of getting right in. Why do you think so many women runners struggle with hip pain that really keeps coming back?
Yes, for sure. This is the $1 million question, really. And I think when we're looking at the hip specifically in regards to needing to be able to run, number one, running is like a really high level activity. And when I think about the things that the hip and the body needs to be able to attenuate with running, we need to have enough mobility, we need to have enough stability, and we need to have enough control, meaning like how does your whole body fit into the mechanics of running? Like if I'm landing on my foot, are my shoulders so far over my hip, or am I having so much like collapse at my ankle or whatever? And I think for women runners specifically, I'm going to really zone in ages like 35 through 55. I think that we maybe have gotten away with like the poor foundation of those things earlier in life. And then as we get into our 30s, 40s, 50s, we can't really get away with those foundational changes. And those foundational changes are the things that I was talking about: mobility, stability, control. I also think that, like, when we're in our third, fourth, fifth decade, as women, there's so many changes that are going on. Like, oftentimes, women will have kids, and that is going to drastically change our body. Or maybe it's just the age old thing of like, I started a full time job and I'm not as active as I used to be. And then I go out and do this volleyball event, or I want to run a 5K. And it's like, I actually like sit most of the day. And then when I go to do these things, I don't have a strong enough foundation to do them because I'm not as active as I used to be. So I think there's just I think with parts of getting older and with parts of just kind of these changes that we have, the foundation isn't there to allow us to participate in this high level activity of running. And then we start to see these hip injuries manifest as we're 30, 40, 50, whatever it is.
Yes, yeah, and beyond, right? Yeah, like
Yeah.
a little Buzz Lightyear reference there. But no, I think you really summarized that quite well, and that are I guess to really just reiterate that the body's doing different things in 30s, 40s, 50s, males and females, but females in particular, like you mentioned, after having children, hormonal changes are definitely kind of specific factors that don't obviously necessarily deal with middle-aged men runners. So thank you for that. And before we dive into like what women need to know to get rid of their hip pain, spoiler alert for you guys, by the way, the problem isn't what you most likely think it is either. Tell our viewers like a little bit about yourself and like what drew you to focus on helping women runners rebuild strength, consistency, and confidence after hip injuries.
Yes, for sure. So the story is twofold. When I was a physical therapist and I was probably in my third year of working as a PT, I was going through my residency fellowship at this point. So I was having to take classes on the weekend. I was like getting mentored during my sessions, or I'd have to do a bunch of shadow hours, all this stuff. I had this like influx of women, probably like aged 40, that came to me with labral tears. And I will never forget the first time I saw this labral tear diagnosis on the referral. I was like, what? Like, am I going to break this woman? Like, I had no idea what to do. I was so afraid. I remember like moving her hip and being like, it is like, am I going to break her hip doing this? Because I just don't feel like in PT school, I really learned about labral tears well. And the things that I knew was like, okay, maybe do some traction on it, made her worse. Like, that's what the textbook said to do. And I just had no idea. So, in this time of being a physical therapist in my fellowship year, I was able to really dive in with my mentor and some of my mentors on how to treat a labral tear and how to treat it well. So I had a lot of repetition. And then, crazily enough, that year, my hip pain started. And it honestly started out of the blue. Like, I mean, it was the pandemic. I wasn't able to load my hip as well. I was running more. And I just had this like kind of classic like groin pain. It came on slowly and then slowly kind of got worse over time. So I really fell into this place of like, okay, I'm like seeing that there's maybe a discrepancy in like the care of women that have this issue. And then like I also had the lived experience of like, I went to PT, it helped me, but it didn't really help me get back to like the full fledged being able to run, you know, multiple times a week at the 6 to 8 to 10 mile mark. So I feel like this kind of like melding pot of this journey led me to be like, I want to be the person that helps women, maybe when they're like done with that initial phase of rehab, get back to running 3 times a week consistently, or get back to running marathons or half marathons or ultra marathons, whatever it like, whatever their dream is. I want to be the person that's like filling that gap because that was me really at one point.
Right. Yeah. No, I love how you kind of took your curiosity and kind of turned it into your passion, right? For what you like love, serving your women runners now with how you help them. So yeah, similar kind of to my backstory. And I think we had talked about this on your show, how I actually got into running after I actually had hip scope and, labral tear surgery and repair. But it is interesting when you go through that yourself, right? And you see that there are gaps in the current healthcare model, and really seeing like, hey, there's a better way that we could be providing care for individuals who have like labral tears. So yeah, that's fantastic. And I know our audience of women runners is going to love like what we're covering today. So yeah, let's just jump right in here with like the main problem. And why do you think, why do you feel like hip pain keeps returning in so many like female runners?
Yeah, for sure. So, kind of maybe building on the foundational aspect that I talked about earlier, I think that is a huge thing. Like they maybe just don't have that strong foundation of having that appropriate hip mobility, stability, control, and then the availability to do that over like a long period of time. Maybe like a quick example of that, if that sounds like obscure, is like let's say a gal has like hip drop. She just has really when she's standing on her left leg, that's her painful leg. The right hip is dropping down and she's getting like pinching into the anterior aspect of her hip. This is fine in her day to day, but as she goes to run for 2 miles, she kind of notices like, oh, that anterior hip pain is getting worse. So maybe upon like a movement screen or an assessment or whatever, we would see, oh, like you have more hip drop on this side, and it's challenging for you, and it actually gets worse once you get to that 2 mile mark. So we're seeing that there is like that foundational change, and this can be brought on by not doing appropriate levels of like strength or stability work. It can be brought on by like long standing history of injury. Like maybe you sprained your ankle 3 years ago and you felt like you never like rehabbed it appropriately, or maybe this is a common one that I see. Women will be like, oh yeah, I tore my ACL in high school and I kind of just like didn't really do a lot like after rehab. And now that I'm getting back into running, I'm really noticing that I am having, hip and ankle pain because I never like really kind of got after the knee. So I think that foundational component, which is not necessarily just strength training, it's really like checking out the mobility, stability, control. I think that's a huge reason. Number two, I think gals and guys are not honest with their volume. I will give you an example. I have a client right now who wants to run a 5 miler. We're actually going to do it together. I'm going to do the 15 miler and she's going to be there for the 5. And I was like, this is so exciting. Like, I'm so excited that you're going to be there for this 5 miler, but she has not been running consistently. So in her last call, I said, okay, this 5 miler is 4 weeks away. You just did a 5K, and that was a little bit of a push for you. Let's kind of plan out how we're going to get there and how you're going to be able to do this safely. And she looks at me and she goes, okay, this week I'm going to do my normal F45 training. And then Saturday, when I'm supposed to do, this is her run day. Saturday is typically her run day. She's like, I think I'm just going to go to my HIIT class. And I was like, tell me how that is going to get you to your goal of being able to run this 5 miler. I think we're just not honest with, like, if I want to be able to run a 5 miler or a 5K or whatever, I need to have consistency in my like running volume to be able to get me there. And I can't just ebb and flow and show up to races like I did when I was maybe 15, or show up to this, sand volleyball event or whatever when I was 15, because my body is probably going to pay, I'm going to say pay more of the price now that I'm, maybe 35, 45 than I did when I was like, yeah, 15 or 14. So I feel like foundation and volume are like probably the biggest culprits I see with my clients.
Yeah, no, I think you bring up some great points there, and especially like that ACL example and ankle sprain example. I would totally agree, especially for those that might have been at the end of their high school sport career, whether it was soccer, basketball, lacrosse, field hockey, right? Whatever the sport was, that they tore their ACL and maybe were fearful to get back and never got back into sport. So they didn't like fully rehab it. Whereas someone who might be a little bit more motivated to be like, hey, I got to get back on the field. I'm going to make sure I do all these strength exercises. I'm going to get my body stronger than it was before the tear. Yeah, those are some great examples of where there might be these muscle imbalances, which lead to, as you describe, just not having that strong foundation, which is going to lead to running like faults and with mechanics and maybe a hip drop going on. So yeah, no, I think that's a great example. And then I would also add maybe even postpartum, right? And just changes in weight, right? Like as you are pregnant with delivery of the baby, any like complications with delivery, any surgeries that are needed after, all of that stuff leads to a lot of weakness, right? Which could affect that like strong foundation that you mentioned. So excellent point there. And then the other point really speaks to what I like to kind of call like training errors, or a lot of, like there is this stigma, especially in the medical community, right? That they're like, oh, well, you have hip pain, so maybe you should just stop running. Like running loads the hip too much and you're getting too old. Like you're over 40. Like maybe you should just like think of another form of exercise, where it is a matter of the training errors, right? And like in your example of not actually running consistently or having enough volume, and you're actually not doing proper training, and all of that's like I call like runner fault. And sometimes it's no fault of our own, like no offense, right? It is just we don't know, and just not building like the training appropriately. Nice. Any other reasons that you see that are pretty common on why kind of pain continues, even maybe like after someone does get hip pain, and it, does have this like, injury cycle effect where it does keep coming back?
Yeah, for sure. I think that this one's maybe a little bit more obscure, but like it's something really big that I've had to actually hit on more in my programs is like the mental aspect of it. I think I see a lot of gals who have done all the right things, like on textbook. Like they went to physical therapy, they went through that 4 to 6 weeks of rehab. They were very consistent, and they did, maybe they did like kind of a standard, I'm going to say standard PT protocol where they're doing like hip and glute specific exercises, and they're feeling better with like that day to day kind of aspect. And maybe they're even back to some of that run walking. But then when they get back into running at those higher volumes, like let's even say it's like 2 miles, 3 miles relative to not running, that is a higher volume. And then that hip pain starts to come back. I think I see a lot of women at that point start to write this story in their head of, I don't think I'm meant to be a runner anymore. Like I did everything I was supposed to do. Or just be like, I don't think that I, should be signing up for races, or my doctor was right. Running's probably too much load for my hip. And I think it's like in this point where it's like it feels really challenging to ask for help again, or maybe even like invest in another PT or run coaching program again. I actually think it's like what gals need to do to like kind of overcome that mental hump. Because at that point, like rewriting that story of like, I actually do think I can run past 40. I actually do think I can run with this, MRI diagnosis, or this hamstring tendinosis, like on my MRI or whatever. I think that mental piece of overcoming that barrier is like one of the biggest reasons that I see people kind of stay stuck in that hip pain cycle, is because they've never broken through that, and just kind of give themselves an identity of like, yeah, I'm just going to do, walking classes and weighted vest walking instead of like running like I want to.
Right, right. And yeah, even we actually did a whole episode on weighted vest walking and the misconceptions of that, and how that actually adds more stresses to the joints than actually running does. But yeah, that mental piece is so important, right? And just having that negative mindset and thought process can be very detrimental. And having, and yeah, like you said, a lot of people have gone through multiple providers where they've tried multiple things and they just keep getting this pain again. I totally agree with that. A couple of things that I was thinking about as you were speaking that I find very common, as well as like reasons why people stay in this kind of cycle, is really resting but then not rebuilding. And they have pain, they reduce what they're doing, they stop activity, they take anti-inflammatories, but they don't address like the underlying weakness, which kind of goes to your point about like, not having that strong foundation. But I find like people go in this like yo-yo cycle where it's like they're all in or they're not in at all. And also going along with that is like their return to run, they might be doing it too quickly, where they're like, oh, I'm going to try running, let me go for 4 miles because that's what I would normally do during my weekday runs, and let's just like cross my fingers and hopefully I won't get my hip pain. And then they get hip pain and then they freak out, and then like maybe I need another week of rest, right? Like kind of that extreme scenario where they're not actually grading and gradually building in their running. And then the big other one is like, I'm sure you still get runners, right? Who are like, I know my hips are bad. I should be doing, I need to stretch more, or I need to do like more yoga classes during the week. Maybe I should do less running. Maybe I should run like once a week or twice a week. And maybe I just need more yoga. I need more stretching. So I would say is, that misconception of they need more stretching, and really what they should be doing is some strengthening. I don't know. Do you find some of those common as well?
Yeah, for sure. I'll have people who are like, oftentimes I'll ask people, what's been bothering you with hip pain or running? And they'll tell me, and then I'll be like, okay, well, what have you tried so far? And the response will be everything. I've done acupuncture, I've done massage, I've done stretching, I've done yoga, nothing has helped. And I'm like, well, that's not really everything that we could be doing. There is that strength training piece, or that kind of graded running approach that I think would be maybe more beneficial than consistent stretching.
Yeah. Is there anything that you use in terms of like guidelines with return to run, or like specific markers that women, need to hit before returning to run?
Yeah, for sure. I mean, I kind of have my own protocol, so to say, of like a kind of a foundational movement screen that I want to see. Without getting like too into the weeds, I feel like the biggest things are like, okay, can you move comfortably over the hip through a full range of motion. So I'm thinking like squats or like even like a hip airplane. Like, can you move through full range of motion in really all directions? Number two is like, how is your single leg stability? Like, can you balance on a single leg well? Can you move over that single leg well with, maybe in like a single leg squat, but then also in the other planes of motion, which is like moving forward, kind of moving laterally and then moving rotationally. And then the last thing I'm wanting to see, and this is a little bit maybe, uh, this is if those first two things aren't great, this last one's probably not going to be great, but sometimes people will surprise you. Is like landing mechanics or like plyometrics. So like how do you do with like jumping onto a single leg, forwards, sideways, all of the above. I really think with running, if we're looking at those foundational things, I want those things to be okay and kind of measured in the beginning. And then I also want to like progress them up to things that are more challenging, like lifting heavier or doing that like hopping to know that they can withstand like the full demands of running. So it's like a spectrum that we kind of go through with the return to run process. But oftentimes in the initial things that I talked about, like the mobility, stability, control, those are the things that I want to assess first. And if those are looking okay, or we're kind of on a map or a plan to get those things better, then we'll kind of start the return to run process with those things, and then progress on to the higher level things like strength and plyometrics, even as they're like building volume.
Nice. Yeah. What I heard there is really you're looking at like normalized movement patterns in the hip with and proper mobility, stability on one leg, because when we're running, we're always on one leg, right? And then plyometric, like running a series of hops from one foot to the other, that you're making sure that they could tolerate, some plyometric activities before they are kind of starting this return to run program, which, yeah, makes sense in terms of like the demands of running. Yeah, I think that's super important because if you're listening to this right now and you've been struggling with hip pain and you have been seeing a PT, and they're like, your hip pain is better. Maybe we'll discharge like next week, and then you'll be good to like go back to running. If you have not been taken through like these three variables that Sarah's talking about, that is, not really making sure that you're going to actually tolerate the demands of running. And like, I'm sure you see this, Sarah, is like, this is where the gap is, right? In our healthcare system is you go from being like pain free. Can you go up and down stairs without pain? Can you walk without pain? And you're discharged. Congratulations. Let's have a graduation party, to getting back to the actual running that you were doing or that you would like to be doing. And there's like that gap. And yeah, what Sarah's talking about, guys, is just bridging that gap and making sure that you have that like criteria that has been met and you have built up the foundation, like you mentioned. And then tailor in that return to running. And I would highly recommend for those that are seeing a PT, like this is ideally when you want to be guided by them, right? And they are adding input into how much and which levers that you're like dialing up and dialing down, because there are multiple variables that can be modified as you actually get back into running again, as opposed to just all or none. You're quote unquote injured to now you're healed from your injury, so go ahead and run. So yeah, I love that you're kind of looking at like that comprehensive movement screen that you have and looking at like specific criteria to help like bridge that gap back into running. And you mentioned like ready for the next level in terms of like strengthening. And I know some of the things we had talked about is like relying too much on stretching, or you really talking about not being, honest with the volume and running consistently, and then that mental aspect. But kind of here's like what, what should, women runners do instead? Like, what are the things that are going to really like move that needle, um, to where they actually will stop this like injury cycle of hip pain?
Yes, for sure. Yeah, this is a huge thing I go over with my clients. Like as I in the Empower Hit program, it really is like we're going to build that foundation, and then we're going to I call it like discover, develop, deploy. We're going to deploy you into a quote unquote normal runner's strength training plan that you could participate in a really great app that has like a strength training program for runners, and that's going to kind of like keep you resilient. And yeah, this is like a constant thing that I'm talking about with my clients is like, once we're done with the Empower Hit program, like, what are you going to do? Where are you going to get your strength training from? Because there's no such thing as discharge. Like there's maintenance, or there's no such thing as discharge or graduation. Like once you're done working with a PT, or once you're done working with me in my coaching program, like there has to be some level of maintenance. So these are like kind of the top things that I describe to my clients, and this is going to ebb and flow if they're training for something and they need to be really high volume, maybe a little bit lower strength, or maybe they're in like a big strength build. But what I really like to see from a strength training perspective is like, I really like the 2-day a week mark for strength training, specifically kind of for the lower body. It can ebb and flow to like 1 to 3 days, kind of depending on, what season you're in and time and all of that stuff. But what I really like is like, I like one kind of bigger compound lift that we're doing both legs. I think this could be like something that we're just building true strength and they can kind of push themselves. I also like to see unilateral lift. So this is really like if they do like my kind of like labral torn side is my right side. I'm like suspicious that I have some dysplasia because it just doesn't like my hip just doesn't I'm going to say it doesn't recruit as well as the other side. And working on that kind of like asymmetry, doing that unilateral strength work just really keeps me honest of like, I'm maintaining my strength on that side, even though it doesn't come as naturally in comparison to my left side that just kind of fires, like no, it's no problem at all. And then other things I like to see are on top of kind of those two kind of bigger strength training components of the compound bilateral lift and maybe like a compound unilateral lift is maybe some like simple stability things. Like, and these are things that like if you have worked with a physical therapist and they're like, I want you to focus on like the hip airplane, or I want you to focus on like a side plank, or maybe it's heel raises or whatever. These are kind of the things that like I like to say to my clients are going to keep you fresh. Like I have some gals right now that are like, they just need more like mobility to their hip. They kind of just need that constant cycle or input of mobility. And it's just one exercise that they need to put in 1 to 2 times a week. Other gals are like so sloppy with their movement and they really need more stability. So I'm like, hey, let's focus on doing like some side planks with some isometric holds, or some like unilateral lifts with some like isometric holds in there. And those are the kind of things that keep them sharp. So if I'm tying it on like a nice bow, like some sort of heavy compound lift, some sort of unilateral lift, and then those little stability exercises, maybe that are tailored to you, is kind of like what I like to see in my runners' strength training programs.
No, I love that. Thank you for kind of breaking that down with like thinking categories of having that heavier compound lift. So I'm assuming you're kind of thinking of like a deadlift, a squat, right? Like maybe a lunge, I guess, if you want to call that on two legs. And then going with a compound or a heavier compound like unilateral lift. What would be some examples for our listeners of those types of exercises?
Yeah, for sure. So we could think of like a step up, like a forward step up, or a unilateral, a lateral step up. That's also appropriate. Like a single leg deadlift, or like a single leg loaded squat. A single leg deadlift with rotation. You're right. Like a lunge could be either compound or sorry, bilateral, unilateral. It doesn't really matter. But yeah, those are some of like the main ones that I'm kind of programming with my clients.
Nice. Yeah. Thank you for providing those examples for our listeners. And then it sounds like some of the stability exercises that you found helpful are side planks, which I agree. I even include that in like my movement assessment just to see what is someone's side support stability, right? And we're looking at those side hip muscles, which are so important for running when we're on one leg, and then also their side trunk muscles, right? Like their core, and seeing if someone can be able to do like a side plank and maybe even lift their leg up and like a star side plank position and see what that stability is. And then I love that you mentioned heel raises as as well, because yeah, our calf muscles, for those that don't know, are the muscle group when we are running at the majority of our runs, which should be at our easy conversational pace, our percentage of muscles that are firing the most out of any other muscle group in our lower body. And everyone tends to ignore the calf muscles, because I can tell you from firsthand experience, I did that for a good like 15 years of my life before I really got serious into running. Yeah, they're just not like fun muscle groups to work on until you unfortunately do suffer from like Achilles tendon pain, plantar fasciitis, and you're like, hey, this is a weak point that I really need to work on. And so now I see it as a challenge, and I'm just like, yes, let's get like these calf muscles and build up as much strength and resilience as possible, because it is so important for running. And then I think you had mentioned like an airplane type of exercise where you're kind of standing on one leg and maybe doing some rotational type trunk movement. Yeah, those are all, I love those examples. And I love how you kind of, and this is how I also do it within my coaching, is like I have these, collection or exercise library, if you will. And it is a matter of when I'm designing someone's program, it's like you pick from like this category here, let's pick an exercise from this category here, and then work it into whatever, plan, whether it is a 2-day plan. Maybe someone is in the off season and they're working on like base building and they're not in heavy duty marathon, half marathon training. Then it's like, hey, let's double down on that strength and that foundation that you're speaking of. And let's, try doing like an 8-week block of, hey, you know what, let's like actually like strength train 3 times a week and maybe run like one less day during this time period. I found that to be like super helpful for folks. But that's what we're doing, is like picking from this category, picking from that category. So hopefully this gives some insight into someone listening where, exercises really shouldn't be like totally random. And I know a lot of, especially, I'm sure you see this all the time, like you mentioned F45, but, the boot camp style strength classes, female runners especially love the classes. I understand they're like very energetic, very motivating. I think it brings sense of community, which is awesome. I love that, right? You can be with others and getting some strength work in. So don't get me wrong, like some is definitely better than none, in terms of strength work. But I guess my big thing with doing a lot of those classes is it's like totally randomized and you're doing like different exercises every single time you have a class. Or, it's almost like you're just like confusing the heck out of your body and you're not actually mastering like movement patterns like you had talked about before. I'm just curious, what are your thoughts about like some of these like boot camp style like strength classes?
Yes. Oh my gosh. Yeah. This is like a huge piece of education that I need to give my clients, because if they do have a goal of, I want to run that half marathon or I want to run 3 days a week. Okay, well, that turns into, you need to have that consistency in the gym so that you are building those healthy foundation, and then you're maintaining it with the strength. I think that's important, of like, okay, let's do like 12 weeks to build the foundation, and then let's really maintain it for the rest of our days with strength. And going into those, classes where it's totally random is not necessarily getting you to that goal. I honestly think that a huge piece of education is like, one thing I'll do with my clients is like literally lay out their week, like Sunday to Sunday. Like, what are you doing Monday? What are you doing Tuesday? Okay, we're strength training this day. I'm using your exercises. I'm running this day. And we'll often find that class, although it doesn't necessarily fit into their goal, maybe it's still something they want to do for that community aspect. But once they learn that they need that foundation and that they need that consistency with running, oftentimes they'll drop that class to 1 time a week, or they'll drop that class to 2 times a week, because they know it's adjunct. It's not like necessarily a disservice, but they also know it's not like feeding into their goals. So that's kind of a big piece of education that I'll do. Another thing I'll do is like, maybe you do like that style of class, and like I know for a fact that there are options out there that are consistent and progressive. There's like a local gym close to my house that does like this 12-week functional strength bursts, and it's the same thing. It's a bunch of women, they get together and they just do a progressive strength training class. And I'm like, if someone's local, I'll offer that to them. Or I know like other apps that are very like, they'll have one move and they'll progress that move throughout the whole month, and then the other things are kind of adjunct and consistent to that. And I'll suggest that to them and have them maybe do it with like their neighbor or something. I think there are like ways to make what is going to get you to strength train work. But we just have to know like what's the stimulus and what's the input that we need, and how can we get it in a way that's like salient and interesting and like motivating to us.
Yeah, no, thank you for mentioning that. And yeah, it sounds like our thoughts are kind of similar on that topic. And if we can go back to the like return to run theme, again, I'm just curious from your experience, are there any particular reasons that one of your, female runners may need to take a more like conservative progression with running that you've noticed?
Yeah, that's a great question. It's interesting because people come to me, oftentimes they will come to me, I'm going to say post yo-yo, like you said earlier, where they have been like getting back into running 4 miles because that's what they used to do, and then they're, like, in pain and need to rest for 2 weeks, and then they, like, try to get back into it. So, a lot of the runners have demonstrated that they have some capability of volume, so they're not coming to me in such a conservative manner, but things that I'll think of if they do need to be a little bit more conservative is, like, if they do have a history of a bone stress injury, that I'm going to be way more conservative with their build. I'm going to be way less. I'm not really going to tolerate them having any pain with running, kind of in that rebuild. I'm also thinking too, like if they're, I don't see this often. Most people will go to like a PT and then they'll come to work with me. But like if they are post surgery, or like post surgical repair, oftentimes like if I am seeing them as their primary PT and we're doing it in that regard, like I'm like with their surgeon. Like I am like, what is your protocol? Like let's follow this kind of to a T. The surgeons that I work with in my area are fantastic and like have really developed like return to run protocols. So I want to be, you know, I want to be mindful of what they're doing so we can keep a great relationship. So post surgical. And then I think just like the last thing is like even like mental, like if someone's like showing me or telling me that they're very apprehensive about running, then I'm not just going to put them on like a 15-minute, trial run as I do with some of my girls. Like I'm going to be like, okay, like this week you're going to go for a 30-minute walk. And for 5 minutes in that 30-minute walk, you're going to go for a run. And then you're going to do it maybe one more time if that felt good. Like I'll give them that option that maybe feels less intimidating, so that they can surprise themselves and be like, wow, like I didn't know I could do that. And that felt great. I want to go for longer next time.
Yeah, I'm so glad that you brought up that mental aspect because this actually just happened yesterday. I was onboarding a new athlete, and they haven't run in 3 years now because they've really just been stuck in this kind of pain cycle. And I always have that conversation with someone. Like I have in my head what I think I would want to start them out with. And for this person, I was getting that vibe that there is a little fear, right? There's a little fear that, hey, I'm a little worried that I'm not ready to like start running again. So I always kind of ask them and say, hey, what I'm thinking is we're literally going to, start you out with 30 seconds of like an easy jog. And then I'm going to have you walk for 1 minute. And we're going to repeat that like 6 times. So it's literally like 3 minutes in total of running. Like, how do you feel about that? Right. Like, does that make you nervous? Does that, and I kind of get a feel for, where they are at mentally, because yeah, that is definitely a variable that plays into it. Because yeah, the last thing that, you want to do when you have someone returning to run is someone who is, hyper aware and a little bit anxious, then every little thing they feel, they might kind of get nervous about it. And always educate, of course, on that as well as like, hey, not only let's say it's hip pain that you're coming back from, but you know what, you're going to be doing something for the first time in a long time. You might feel some aches and pains in your feet and your ankles and your knees. Totally normal. Like your body's adjusting to the demands of running again. And just to give them a heads up and they don't like freak out and be like, oh my God, I have a foot injury. Like, what exercise should I do for that? I get that a lot of emergency messages in Final Surge. So yeah, education is important, but that mental piece is, yeah, I like that you brought that up in terms of like starting with more of that conservative route. And then I guess, Another question that I was thinking about that goes along those lines is, and I know you mentioned bone stress injuries already as like conservative route, which I completely agree with. If you have a history of stress fracture, then you definitely want to take more conservative route. But are there any like red flags in your mind that really someone, let's say, who is listening to this, that, we want them to know that maybe, they shouldn't start running, or maybe they shouldn't be forcing it. And like, yes, like you and I, Sarah, sounds like have same mindset of like, you know what? Our bodies are pretty amazing. Like it's going to adapt to the demands of running again, as long as you do the right things, you take the right steps, right? But are there any like red flags in your mind where someone would realize, hey, maybe I'm not ready to actually start running?
Yes, totally. Yeah. A couple of things come to mind. I think I went through earlier. I know I went through earlier, like kind of that movement screen that I do of like, can you move comfortably over your hip? Can you stand on a single leg? I think like if those things are like just consistently really uncomfortable, like for you to go to like sit to stand, if every time you're like moving over that hip, that's just like not comfortable, or if standing on that single leg is uncomfortable, then like thinking about, hopping on foot after foot after foot probably just isn't going to be super comfortable either. Another thing I like to do with my runners, if they haven't been running for a long time, um, is also or I'll just kind of ask them this, like, how much are you consistently walking? Like, can you walk like 3 by 30 minutes comfortably, throughout the week? Like that's kind of the typical threshold that I'll ensure that they're hitting. And sometimes people literally don't because they work from home or whatever. And then other people are like, oh yeah, like I do that every day going to the train, and I think I can handle that. Those are big things. I think the other thing is like if your pain is like it has an inappropriate response, or it's like lasting a long amount of time. Like let's say you do go for that 30-minute walk, and you that was new for you, and then that was 30 minutes of load, we'll say, and then your pain is lasting for like 2 days after that. That's like that ratio is not like 1 to 1, it's like maybe 1 to 4 or something. So I feel like if your pain isn't getting better, or you're just doing a little bit and there's like this kind of huge response to it, that to the load that doesn't seem like it's adding up, I think that's a great time to reach out and get professional help for whatever's going on.
Yeah, thank you for mentioning that like duration of pain after the run. And even during the run, like I'll have some people who kind of freak out, right? Even if their pain levels are a little higher. So if we're just using like kind of like, red light means stop, green light means go, yellow's in the middle, and you're, making a decision 0 to 3 is like green, all things like continue moving forward. Yellow is like 4 to 6, let's say. Anything above a 6 is 7, 8, 9 out of 10 pain. Maybe you should stop running. But even like I'll have someone feel like a 6, but they only felt it for like 2 seconds during their run, like one time, and it didn't come back again. Like that's something to not worry about. But if it is even a 4, let's say less intense pain, it's a 4 out of 10, but it's lasting beyond that hour after the run, or it's lasting into the next day. Like you said, like this duration of pain that is just the after effects. I find that as like super important variable to kind of, look out for. So yeah, thank you for bringing those up. And yeah, like heading down kind of the final stretch here. If you could change one thing about the misconception of recovering from hip pain as a runner, what would that be?
Yeah. Yeah, this is something I've been thinking a lot about recently, and just chatting with more people about their hip is I think just the results of the MRI. Like I think seeing your MRI at whatever age you get it can be so scary. Like and I think it's different when it's a labral tear or hip impingement, or there's fraying of the labrum, or there's like tendinopathy of the hamstring tendon. I think these things are scary because they're not necessarily like soft tissue. They're not muscle potentially. So it maybe feels more alarming. Like my body is not perfect anymore. Like now I'm 40, and this I know this wasn't there when I was 20, which maybe that's not true because it probably partially was. But I just really wish that the MRIs were delivered I just wish the MRIs were less scary, and that, like, upon the delivery, there was like, "Hey, you have a labral tear, and you have hip impingement, and you have hamstring tendinopathy with this, but also so does 50% of the population, and this is a relatively normal finding for your age, and, like, with the appropriate care, I think we could really figure out kind of what the root cause for you is, and you can appropriately rebuild so you don't have to live in fear over this. Like, I can tell you without a shadow of a doubt, I have clients who will work with me and then they will have an orthopedic consultation. Like, you know, it's some duration of our program. Like, they'll be like, "Oh, I scheduled this months ago. This is the first time I can get in. I'm going to go in and just, you know, meet with the surgeon." And I'm like, "I think that's a great idea. Go for it." 100% of the time, the next call, they're in tears because they were told something that was really scary, and it's both. It's both I was told that I am a good candidate for surgery, and I was told that I was not a good candidate for surgery. Both are coming up to me in tears after that consultation, and I just wish that we knew that these findings were more normal, and we didn't feel like zebras. We knew that we were like horses, and that there are ways to like move past this, and we don't have to like live in fear over. We can take them seriously and know that they're there, but we don't have to live in fear over like our MRI findings.
Right. And so just like providing that context, right, which unfortunately isn't delivered. And in the radiology world, and then definitely in the orthopedic like surgeon world, I would say, yeah, it's like black and white. Like, here's what the image showed, and you know what, I here are your options, right? It's like kind of like surgery, injection. And then we can send you to PT, and it's kind of like that's like their algorithm, and it's like, well, we could start with the most conservative first. You can go to PT. If that doesn't work, then we'll do an injection. If that doesn't work, then we can go in and do surgery. Um, as opposed to like you said, of delivering that information that like, hey, this is fairly normal. There are a lot of people who have what you have, and most likely like you've probably had this. And like your example they use, like I had a degenerative labral tear before I wound up having surgery, and I had a chondral defect as well. But yeah, like just seeing that, and even though I was a sports medicine PT, it was like, yeah, like that messed with my mind. I was like, damn, I have like a macerated like labral tear. That sounds terrible, right? Like, oh my God, like, am I not going to be able to run? Like, I just started like running and getting active in my 30s, and it was like scary, even though I kind of knew like what the images were showing. Um, yeah, like providing that context. And so I guess, yeah, more of our story today is, if you're listening to this and you've gotten these diagnoses before, don't let that fear stop you from doing all in your power to be able to overcome this and stay active and stay running. And many of these you don't need surgery for. Like I mentioned, I kind of started like beginning my running journey getting surgery. Um, it wasn't because of my labral tear. Like, I am convinced on my right side, I definitely have a labral tear. Never had it imaged, but I just have really stiff hips. And I know I have a pincher impingement in my hip joints, like in my hip sockets. And like, that's okay. Like, I'm not looking to be like a Major League Baseball catcher. I'm not looking to be a goalie in hockey. I'm not looking to do like splits and gymnastics, right? Like, so I'll be totally fine running in an upright position because, yeah, that's like pretty good for our hips. Um, so, yeah, if you've been feeling defeated and maybe you found this episode because you like had no hope that you can run, like, yeah, like Sarah and I will tell you, we've worked with many, many people who have labral tears, hip impingement syndrome, or any of these chronic tendinopathies like PHT, and you can get back to running. So hopefully this like provides some help. And yeah, Sarah, like this has been incredibly helpful for women runners like watching this who are like stuck with that like rest flare up cycle and need more personalized support. Like, where can they find you?
Yeah, I am all over social media. So I'm the Hip Doc Sarah on Instagram, TikTok. YouTube. You can also reach me. I'm also very active in my DM. So if you message me, it's me, I promise. And you could also email me at sarah@legacyrehabandperformance.com if you heard this episode. And if anything stuck out to you, I'm more than happy to chat about it over email. But those are the top couple of places.
Yeah, thank you for sharing that info, and I'll definitely put all those links in the show notes. It's been real great chatting with you today. Yeah, thank you for taking time into your busy day to come on and share with our Healthy Runner audience.
Thanks so much for having me. I appreciate it.
Yeah, and if this conversation, hopefully, like helped you guys understand why your hip pain keeps coming back, hit that like button and drop a comment, and telling us like what's your biggest struggle with hip pain. If you want to learn more like injury prevention content for running, definitely subscribe to the Spark Healthy Runner YouTube channel or the Healthy Runner podcast. Now that you know more about why your hip pain keeps coming back, you're ready to learn the secret to stronger hips with 5 simple hip strength exercises any runner can do. If you're listening to the podcast, then queue up episode 170 on the Healthy Runner podcast. And if you're watching this on YouTube, then just click the video that I have for you next. As always, let's continue to grow a strong mind, a strong body, and just keep running, friends. Until next time.